What is diabetes? Diabetes is a condition where your body can't produce insulin, doesn't produce enough insulin, or where your insulin doesn't work properly. Insulin helps your body use the sugar, also called glucose, in your blood to give you energy. If you don't have the right amount of insulin, or if your insulin isn't doing its job properly, your blood sugar level will remain high. This can make you very ill. What type of diabetes do you have? Your doctor or nurse will tell you what type of diabetes you have. There are two most common types, which are called type 1 or type 2. There is also gestational diabetes, which is diabetes that can develop during pregnancy. There are other rarer types too. Type 1 diabetes. Type 1 diabetes can be diagnosed at any age. The symptoms of type 1 diabetes tend to come on quickly, over just a few days or weeks. People with type 1 diabetes can't produce insulin naturally. There is nothing you can do to prevent yourself or others developing type 1 diabetes. The exact causes are not known. Type 2 diabetes. Type 2 is the most common form of diabetes. This type usually starts later in life, although it's occasionally diagnosed in children. There has been a rise in people diagnosed under 40. Type 2 diabetes develops more slowly than type 1 diabetes. You might get type 2 diabetes because your family history, age, or ethnic background puts you at an increased risk. There are also a lot of other risk factors for type 2 diabetes, including environmental and genetic factors. You are also more likely to be diagnosed with type 2 diabetes if you're living with overweight. There is strong evidence, though, that some people can put their type 2 diabetes into remission by getting to support to lose weight where appropriate. Look after yourself. Being told you have diabetes can be a real shock, and learning to live with it can be a challenge. You might be going through all sorts of different emotions. This is totally normal. Being diagnosed with diabetes can mean taking medication, changes to what you eat, and doing more physical activity. This can all feel daunting, but many people say they get used to these changes and find balance in their lives. Eat well. We should all eat a healthy diet as much as possible. You can get expert advice on healthy food choices that are right for you by seeing a dietitian. You can ask your doctor or nurse to refer you. Keep active. It's good for everyone to keep physically active, but especially if you have diabetes. Being active can help your body use insulin better and reduce your risk of developing diabetes complications like strokes or heart attacks. Most adults should try to do at least 30 minutes of exercise 5 times a week. You can ask your doctor or nurse about ways to keep active that are right for you. Give up smoking. Smoking is bad for everyone, but if you smoke when you have diabetes, you can also increase your risk of diabetes complications, including heart attacks, strokes, and problems with your feet. Smoking can also lead to other serious health problems. Giving up can be hard, but you don't have to do it alone. In fact, you're more likely to quit if you have support. You should speak to your doctor or nurse about quitting. The NHS Better Health website provides advice about treatments that can help you quit, including nicotine replacement therapies and prescription medication. You could also download the free NHS Quit Smoking app. Managing your diabetes. Your doctor or nurse will talk to you about how to manage your diabetes. Depending on your type of diabetes, you might need to take tablets or do insulin injections or both. You might need to use an insulin pen or pump. It's important to eat healthily and be physically active as well. Everybody's different, and it can sometimes take a while to find out what works. You might need to change your treatment over time. Your doctor or nurse will continue to work with you to find the treatment that's right for you. Make sure you understand what you need to do and that you're happy to do it. You might want to make another appointment to go over things again and make sure you have all the information you need. Diabetes UK are there to help. Diabetes UK have the information and support you need to help you manage your diabetes well. There are lots of different ways they can help. The website has information and practical tips on living with diabetes, from care and treatment to eating and living well and understanding your condition. You can also find out about support groups in your local area. The specially trained advisors can give you information and practical advice on many aspects of living with diabetes, including food, getting active, work, driving and travel. You can order or download practical guides free of charge from the online shop. You can get advice and support from thousands of other people living with diabetes by joining the Diabetes UK Support Forum. You can also sign up for online learning. The Learning Zone is a free way to learn about type 1 diabetes or type 2 diabetes online in your own time. Remember, you are entitled and encouraged to request a British Sign Language interpreter to attend your health appointments with you.